Hello, Assalamu alaikum. How are you?
Okay.
अच्छी है,
हाँ
अच्छी है ना?
सही है, ओके है।
बाद अच्छा शुरू से
हाँ
रहना चाहिए।
सर स्टूडेंट आया था वह
मैं चेक करूँगा।
55
बस ठीक। या मीठा नहीं, मीठा चल ना। मेहरबानी। Hello, Assalamu alaikum. I'm Dr. Jawaid Memon. So today we discussing a topic related with the tumors of the heart. So the tumors of the heart, and they are the tumors of the heart, and they are very rare. In contrast to the in contrast to the metastatic tumors. So the primary tumors, the most commonly, they're the primary tumors of the heart, and they will also come including they're the myxomas, rhabdomyoma, fibroma, and papillary fibroblastomas, and also the other tumor. Number one is the lipoma, and these are the primary benign tumors of heart. They can comprising you know about the classification of the tumors of the heart. So number one, benign tumor and malignant tumor. Benign tumor, they can comprising there the about the primary tumors of the heart, and they are very rare, but they are so in contrast to the some that are metastatic tumors and to the involving within the heart. So the group of the benign tumor concerning the heart, they were including number one, they are the myxomas, and another one there is the rhabdomyoma, fibroma, and there are the papillary fibroblastomas and lipoma. So these are the benign tumor, and the malignant tumor they can comprising there the sarcoma lesions. They were also comprising their angiosarcomas, and there the myxosarcomas, and also the other tumor they can arise from the cardiac muscle, and also the along with the rhabdomyosarcomas, a tumor arising from the other like the fibrosarcomas and also the leiomyosarcomas muscle tissues. They were also can be including in the rare incidents. So this is also a primary tumor of the myxoma. Primary tumor of the heart is a very benign. It is also a primary benign tumor of the heart. So myxomas, and they are the most common primary tumor of the heart. Most common primary tumor of the heart, and they also can occur within the adulthood. Adult में होता है, ठीक है बेटा. And although and they may also in any of the most probably they also can occur and within the any four of the chambers of the heart. So they will also can be involving any four of the chamber. They will also can be involved. Rarely they will also can occur within the heart valves. But the most common site, and they will also can including about 90% of the cases, and they will also can occur within the atrial. So the atrial myxomas, and they will also can be very common. Atrial, okay. So the most common site it is also in the atrial region, but the frequency of this tumor, they will also can involving in any of the four chamber. They will also can be of the heart. They will also can be involved, but the most common site is a atrial site. Okay, these tumors, the tumor cell types, and they will also the tumor cells, and they will also can be presenting, and they also can be thought to be they also can be derived from the differentiation of the primitive and there the multipotent multipotent they are mesenchymal are cell type. So they will also can be arising from the pluripotent mesenchymal cells. Okay, what are the morphological features? Morphological features of the myxomas. Myxomas is also benign, primary benign tumor, the myxomas, and they will also can be almost always, and they are almost always they are appear as a single, and but rarely, but also appear as a rarely, but rarely they also can appear in the several centimeter. They also can be in the diameter. Okay? Severally occur. कभी कभार most probably single होता है, but they also can occur in the some one or two in the diameter. When the two the region most probably the region the fossa ovalis, the most common site for the occurrence of the atrial myxoma. It is also a region fossa ovalis, and within the atrial septum. This is the most common favorable site and for the presence of this tumor or the myxomas. Myxomas, and they also can be ranging from इसकी जो बड़ा मेयर में होती है ट्यूमर की grossly, they will also can be appear the small, they are the less than about the 1 centimeter in the diameter and up to the most probably, and they were as large about the and up to the 10 centimeter तक वो हो सकता है. ठीक है बेटा, इसकी जो diameter of this tumor, they are most probably they are mostly small, and but the diameter is about between the 1 centimeter and up to the 10 centimeter in the diameter. And they also can appear sessile भी होती हैं, growth or the pedunculated, कभी कभार उभरती हुई growth होती हैं, pedunculated and masses, and that also can be vary from the, they can vary and form vary from, they are the globular, they are hard masses. अब कभी कभार hard masses hard masses also can appear. ठीक है बेटा, तो ये they also can be noticed. Okay, so they also can appear as a pedunculated or sessile growth. Sometimes they also having the globular hard masses. So they also can appear as the gross features of the myxomas. So this is also microscopical features of histologically myxomas, and they are composed of the steroid cells. They are composed of steroid cells, and are the globular myxomas. Globular myxomas, they also can, and some they are the endothelial cells, and there is smooth muscle cell, and also the undifferentiated cells. They will also can be appear undifferentiated cell type. They also can occur within this tumor. They will also can embedded in the most probably abundant. There also can occur acid mucopolysaccharide background. See ground के साथ they will also can appear some their endothelial cell proliferation, and along with the smooth cell proliferation, and they will also can, and undifferentiated cell they also can presenting and in the acid mucopolysaccharide background के बीच में होते हैं. And these tumors they will also can producing the hemorrhage. Some they are also can be mortal with the hemorrhage भी हो सकती है. They also can be containing. So these are the some they are the microscopical feature of the myxomas. Some they are echocardiography, and they will also can be prove that, and they also can be prove that they also have their opportunity and for the diagnosing of a case of the myxoma opportunity, and for the identification of the masses they also can occur non invasively. They will also can diagnose on the echocardiography, and approximately about the 10% of the patients, and they will also can be with about the 10% of the patient with myxomas, and they will also having a familial and the familial cardiac myxoma syndrome. They will also can be called as, or the known as the Carney syndrome. Carney syndrome. This condition is also an autosomal dominant transmission dominant trait. They also can associate with the some there is the cytogenic disorders. So these tumors they are having the cardiac and extracardiac myxomas, and they will also can be they are also seen एक्स्ट्रा कार्डिक भी हो सकता है, कभी कभार कार्डिक भी हो सकता है. मोस्ट प्रॉब्ली दे आल्सो कैन occur. The most common is key. And then after history and physical examination, and they are very important and for to reach the appropriate diagnosis of these cases. So myxomas, the myxoma is the primary benign tumor of the heart. The most common site is the fossa region, fossa ovalis, within the atrial septum. This is the most common site, and uh, for the occurrence of this type of case, these tumors, and they are the small in size, about 1 centimeter and up to the 10 centimeter in the diameter, and they are sometimes they are the sessile and pudiculate growth of the masses, and these lesions, and they will also having the some there they these lesions, and they will also having there is some of the some there the globular and hard masses, and along with their mortal with hemorrhage. So these are the benign. This is the morphological feature, microscopical feature of the this type. They also can be composed of the stellate cells, and some that in the globular masses, globular myxomas, and some that endothelial cell, small cell proliferation, and undifferentiated cell, and they will also can be occur embedded and in also in the acid mucopolysaccharide background. These tumor they will also having the hand hemorrhage, and also the and some the mononuclear inflammatory cell infiltrate, inflammatory cells, and they will also can be present usually they will also can be present in this case. Okay, history. Okay, the majority, the most probably there the major clinical manifestations of this case they are also can be uh, they are also having with a valvular some appear of a ball valve obstruction. They will also can produce ball valve obstruction. They will also can be uh, and some there is presentation of embolization. Some there is constitution symptoms, and they will also can be among the these type of the cardiac tumor, including fever, malaise, arthralgia. So these are some constitutional symptoms. They also can be occur, but the systemic lesion they also can be involving like the ball wall thrombosis, ball wall obstruction, and embolization of the condition. Okay, echocardiography they also can be give the some help for the diagnosis of a case of the atrial myxomas. So this tumor they also can be 10% of the cases, and they will also can be associating with the familial cardiac myxoma syndrome. This also can be called as a Corny syndrome. It is also autosomal dominant trait disorder. Another benign tumor, lipoma. Lipoma is also a benign tumor of the adipose tissue or the fat, and they are arising from the mesenchymal or connective tissue. So this tumor they will also can be occur within the heart. So they're the lipomas, and they are well, well circumscribed and well circumscribed, and they are the benign, well circumscribed, benign, benign, and they will also can be benign accumulation of the adipose tissue. Okay, so these are the primary benign tumor of the heart. They are the well circumscribed, and they are benign, and also the accumulations of the adipose tissue. Most commonly, they also can occur within the left ventricle under the right atrium. The most common site, left ventricle, right atrium, and also the septum. So this is the most common site, and for the occurrence of the lipometacillian or the lipomas, and they are poorly encapsulated. They are poor encapsulated, and also they are the localized. They are poor encapsulated and localized masses, and they which may be which may be asymptomatic, and can also can be creates, most probably they also can be creates a ball wall thrombus, ball wall obstruction, as they also can occur with the myxoma. जो हमने बेटा myxoma के साथ जो ball wall thrombus obstruction देखी थी, this type of the symptom most probably they also occur in the lipoma. They also can be comprising as a benign tumor of the heart, involving the heart tissues. Okay, or and may also can be and they also can be uh, producing, and they also can occur arrhythmias. They also can producing the arrhythmias. These are some symptoms. They also can be occur in with this tumor. So in atrial septum, most of this tumor they also can occur in atrial septum. So there is also a non-neoplastic in atrial septum. There is a non-neoplastic deposition of the fat, and they are also known or called as lipomatous hypertrophy. In the left atrial septum में जो deposition होती है non-neoplastic, कभी कभार इसी condition they will also can develop on the this area. In the left atrial septum, they are also can producing there is a deposition of the non-neoplastic fat adipose tissues, and they are also can called as a lipomatous hypertrophy. This condition also can occur in the heart tissue. So the third one is the papillary, they are the fibroblastomas. So now we already done the two tumors, the benign tumor. Now we can see the microscope. There is some gross features of the myxoma. Now this is also a So this is also atrial myxomas. They also can showing on the photography, the CT scan. So this is also a myxomas. So we also can see atrial type of the myxomas. This is the most microscopical features of this condition. So this also find the stellate cells and also some that the aerosol cell proliferation within the atrial. So now we can discussing this another one. There's a lipoma. So you can see this is a myxomas. So this is also a lipomatous lesion. This is a lipoma. This is also a well circumscribed lesion. This is also a well circumscribed lesion. They are composed of the fat tissue, and they also can occur in the heart region. This lipoma is a gross pattern. Microscopically, you also having there the composed of the numerous adipocytes, multiple adipocytes. The intervening is the fibroceptors. Now we can start. The third one is the papillary fibrostomas. So this is the third one. Tumor is also benign tumor fibroblastomas, and they are usually incidental. कभी कभार बेटा जो incidental finding होती है, incidental lesion, most probably most most often they will also can be identified at the most probably also can be identified on autopsy examination. ये डायग्नोस होता है जब पोस्टमार्टम की स्टेट होती है, उनमें ये डायग्नोस होता है. ठीक है बेटा. इट्स incidental finding of this tumor papillary fibroblastomas. So they may also can be embolized. They may embolize and also becomes clinically, and they also become clinically important. Okay, some of the microscopical features, morphological features, as well continuing the gross and the microscopic feature. Papillary fibroblastomas, and they are also generally located, most commonly located on the valves valve, and particularly most commonly within the ventricular surface. They also can occur on the ventricular surface of the semilunar valve. So the ventricular surface of semilunar is the most common site, and the atrial most probably the an atrial surface of the atrioventricular surface. So this is the most common site for the gross spectrum of the papillary fibroblastoma. They are also confirming the projections. So they will also can be they constitutes and they are the distinctive constitute distinctive clusters of the hair-like projections of this hair-like projections. They also can occur and up to about up to the 1 centimeter in the diameter. The most common, they also can be covering up, and they also can be covering up to the and covering up to the several centimeter. They also can covering up to the several centimeter, and also the cover the endocardial tissue. There also can be endocardial surface tissues. Okay, and the microscopic histologically, and they are also covered by the endothelium. They are also covered by the endothelium and deep to the and they also can be deep to which also can cover and cover the myxoid. They also can be myxoid connective tissue. So they will also can occur in the myxoid connective tissues. So this is also microscopical feature. They also can occur in this papillary. They also having the hair-like projections, and about the 1 centimeter they also can cover and deep to the 7 centimeter तक उसको जो cover कर सकता है. So now we can also can see this is the microscopical feature and the gross features and the microscopic feature of this tumor. Papillary fibroblastomas. Now this is also papillary fibroblastomas. They are also having the hair-like projection over here. You can see in this case. Okay, this is the most common feature of the papillary fibroblastomas. Now in the last we also can be doing fibroma. Fibroma is also a benign tumor of the fibrous tissue, and they also can be composed of the fibrous tissues. Benign vesical origin. Rhabdomyomas. Now the another benign tumor called the rhabdomyoma. Rhabdomyomas, and they are most frequent. They are the most frequent primary benign tumor of the heart. Most probably benign tumor heart, and they will also can occur in the infants and also in the children, and they are frequently they are also can be frequently and discovered and in the life in the first year of the life. Most probably also can occur in the children, in the infants, and most commonly discovered in the first year of the life. And because of the obstruction of the heart valvular orifice. Okay, because obstruction of the heart valve orifices and or there the cardiac chambers. There also can occur some there the obstruction. This tumor, they also can some there studies and suggested that and there the some there the cardiac rhabdomyomas and may also rhabdomyoma may also can occur, and due to the some there the defects occur in the apoptosis. Some there the recent studies apoptosis, and during the developmental developmental there is a cardiac according there is a remodeling. जब cardiac development होती है, they also can have some there is change occur. They also can further then the incident develop for the development of the rhabdomyoma, also benign primary tumor of the heart muscles. Now there is the rhabdomyomas, and they are most frequently also primary tumor of the. So now we also have to do the morphology of the rhabdomyoma. And they are they are also can appear generally. They also appear this small and also the gray white masses. Gray white, there is the gray white, there is the myocardial masses, gray white myocardial masses, and up to the several centimeters in diameter. Okay, they also can occur in the up to several centimeters in diameter. They also can located most probably on the and either the left in the left or the right, either of the left in the left and left or the right side of the heart. Heart most probably also occur in the rear left right heart chambers. Most commonly they also can occur histologically. Histologically, this tumor is also composed of the mixed population of the cells. This tumor is also composed of the mixed population of the cells, and the most characteristics of which most probably they also can occur. They are the large and also the rounded or the polygonal cells, large rounded or polygonal cells, and they will also containing the numerous 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 glycogen laden vacuoles. They also can be containing the numerous glycogen laden vacuole present over here, and they are separated by the strands of the some there is strands of cytoplasm, and also the more or less more or less and they will also can be containing there is a containing centrally located there is a nucleus. So this is also a benign tumor of the most probably the morphology feature of the rhabdomamas. Now sarcomas they also can be concluding the cardiac sarcomas, including angiosarcomas and other sarcomas like the rhabdomyosarcomas, mesosarcomas, liposarcomas, and there's the fibrosarcomas, leiomyosarcoma. They will also can be occur in the really in the heart tissue. So the most probably the cardiac angiosarcomas, and other sarcomatous lesions are, and they are not not classically, but and they are the most probably they're the morphologically they're the distinctive. Okay, so these are some sarcomas. They also can occur within the heart tissue. Angiosarcoma is also tumor of blood vessel, and they also can occur within the another tissue. They also can involve extension of the tumor. Now some there's a cardiac manifestation. There's the cardiac effects of the neoplastic lesions. Number one, they are the direct consequences of the tumor. First of all, there is the pericardial and most probably the myocardial metastasis. This tumor they will also can be metastasis within the pericardial and myocardial metastasis, and another one a large vessel obstruction, and third one is there the pulmonary tumor emboli. They will also confirm over the indirect consequence of the tumor, and they also having there the some there the complications complications of the complications of the circulating complication of the some there is circulating mediators. Another one they are having the non-bacterial thrombotic endocarditis. So they also have the some there the endocarditis, and some there the cardiac, and most probably there the cardiac, and there the carcinoid heart diseases, and they will also can occur by the indirect consequence of the tumor, and some of the like the effects of the tumor effect of the tumor. So therapy, there's radiation and the radiotherapy and the chemotherapy also can given to these patients. Okay, now we can see these some of the rhabdomyomas and with the some of the pictures. So this is the papillary fibrostomas. So this is another one. There the rhabdomyoma, and the next this is rhabdomyomas. Most probably the angiosarcomas. So this is also a most rhabdomyosarcoma. This is also a malignant tumor. They are also called rhabdomyosarcoma. This is also a malignant tumor. There's the fibrosarcomas. So this is also malignant tumor arising from the mesenchymal origin. They also can occur in the heart tissue. There's the leiomyosarcomas. This is also a tumor of smooth muscle cell, and they are also present in the heart tissue rarely. Now, this is also a now, but this is all of about the tumors of the primary tumor of heart. Really, the benign tumor comprising myxomas, fibroma, and there also there is the lipoma, papillary fibrostomas, and rhabdomyoma. And the malignant tumor, they are considering the sarcomatous lesion. Sarcomas, and they will also having there the sarcomatous lesion. These tumors, and they will also can be angiosarcomas, there's the rhabdomyosarcomas, and also the other like leiomyosarcoma, fibrosarcoma, rhabdomyosarcoma. So these are the some malignant tumor. They also can occur within the sarcomatous lesion, occur within the heart tissue. Okay, some of the clinical features of the lesion, there's the heart, some there's the fever, and well as arthralgia, so weakness. So these are some constitutive symptoms related over here, but systemic symptoms they also can occurring in these cases, like the depending upon the obstruction or any involvement within the affected part of the heart tissue. So our cardiovascular system disorders, and now compared over here. So the blood vessel lesion we already done, including number one, there the first of all we done the vasculitis and atherosclerosis, and there the including arteriosclerosis, and third hypertensive heart disease, hypertension, and disease of the lymphatics and the veins, and fifth one is including there is a tumors of the blood vessel in the including in the disease the lesions of the lesions occur within the associated with the blood vessel. Now we also can already done the uh, cardiovascular system disorder, including heart failure. Number one, there is cardiac failure, and there is ischemic heart disease. There's angina, myocardial infarction, and also some disease of the myocardium, like the myocarditis and cardiomyopathies, and also some disease of the pericardial diseases, pericardium, pericarditis, and effusion, and also the rheumatic fever, and infectious enteritis, and other valvular heart disease, and congenital heart disease, and also the some in the last we also can be discussing the tumors of the heart. So inshallah we also we will start in the next lecture with the disease of the central nervous system. Thank you, beta. Darail, بس دي صور lecture بس بس دي صور lecture.